ADDISON'S disease is an endocrine disorder look at these pictures. CT scan shows that adrenal cortex detail going on. Introduction. Addison's disease, also known as primary adrenal insufficiency, is a rare but serious disorder where the adrenal glands do not produce enough of certain hormones. Named after Dr. Thomas Edison, who first described the condition in 1855. It primarily affects cortisol and aldosterone production, which are crucial for stress response, metabolism, and maintaining blood pressure. Definition. Addison's disease is a chronic endocrine disorder where the adrenal cortex is damaged, leading to insufficient production of cortisol and aldosterone. It can lead to severe dehydration, low blood pressure, and imbalances in blood electrolytes. Types. 1. Primary adrenal insufficiency, caused by damage to the adrenal gland themselves. Second, secondary adrenal insufficiency resulting from inadequate production of adrenocorticotropic hormone ACTH by the pituitary gland, which stimulates the adrenal glands to produce cortisol. Three, tertiary adrenal insufficiency due to dysfunction of hypothalamus, leading to decreased secretion of corticotropin released hormone CRH. Causes. 1. Autoimmune disorders. The most common cause where the immune system attacks the adrenal glands. Second, infections, tuberculosis, HIV, fungal infections that affect the adrenal glands. 3. Adrenal hemorrhage, bleeding into the adrenal glands, which can occur with severe infections or trauma. 4. Genetic conditions. Certain genetic disorders can affect adrenal gland function. 5. Cancer. Metastasis to the adrenal glands can cause damage. Risk factors: family history of autoimmune diseases, presence of other autoimmune conditions, example type 1 diabetes, thyroiditis, chronic infections, use of anticoagulants which may increase risk of adrenal hemorrhages, adrenal gland surgery, complications. 1. Addison's crisis, a life-threatening condition characterized by severe pain, vomiting, diarrhea, dehydration, and shock. 2. Electrolyte imbalances, low sodium and high potassium levels can lead to severe complications. 3. Low blood pressure, chronic hypotension can lead to organ damage. 4. Metabolic issues, impaired glucose metabolism and weight loss. Pathophysiology. In Addison's disease, the adrenal cortex is unable to produce adequate cortisol and aldosterone. This results in 1. Reduced cortisol, impaired stress response, metabolism and immunofunction. 2. Reduced aldosterone leads to imbalances in sodium and potassium, affecting blood pressure and fluid balance. Signs and symptoms. 1. Fatigue, persistent and chronic tiredness, muscle weakness, generalized weakness and reduced physical stamina. 3. Weight loss, unintended weight loss despite normal eating habits. 4. Hyperpigmentation, darkening of the skin, particularly in creases and scars. 5. Hypotension, low blood pressure, which can cause dizziness and fainting. 6. Salt craving, intense craving for salty foods due to low sodium levels. 7. Nausea, vomiting and diarrhea, means digestive issues are common. 3. Joint and muscle pain, generally body ache. Medical diagnosis: 1. Blood tests measure levels of sodium, potassium, cortisol, and ACTH. Second, ACTH stimulation test evaluates how well the adrenal glands responds to ACTH. 3. Imaging test CT or MRI scans to detect abnormalities in the adrenal or pituitary glands. 4. Antibody test detect autoimmunomarkers that indicate Addison's disease. Nursing diagnosis: 1. Fluid volume deficit related to insufficient aldosterone production. Second, risk of infection due to impaired immunoresponse. 3. Activity intolerance due to muscle weakness and fatigue. 4. Imbalanced nutrition less than body requirements related to weight loss and gastrointestinal symptoms. 5. Anxiety related to chronic illness and potential for Addison crisis. Management: 1. Monitoring regular monitoring of electrolytes, blood pressure, and hormone levels. Second, education teaching patients about medication adherence, recognizing signs of an Addison crisis, and importance of maintaining a balanced diet. Treatment: 1. Hormone replacement therapy, lifelong replacement of cortisol and aldosterone. Second, stress management, adjusting medication dosages during period of stress or illness. 3. Emergency injections, providing injectable cortisol for emergencies such as an Addisonian crisis. Psychosocial medicine: 1. Support groups connecting with others who have Addison's disease. Second, counseling addressing anxiety and depression related to chronic illness. 3. Patient advocacy, encouraging patients to advocate for their health needs. Prevention: 1. Early diagnosis and management of adrenal insufficiency. Second, regular monitoring and adjustment of hormone replacement therapy. 3. Avoidance of stress and infections that can precipitate an adrenal crisis. for educating patients about the importance of carrying medical alert identification. Conclusion: Addison's disease is a serious but manageable condition with appropriate medical treatment and lifestyle adjustments. Early diagnosis, regular monitoring, and patient education are crucial to prevent complications and maintain a good quality of life. Ongoing research and improved therapeutic strategies continue to enhance the management and outcomes for individuals with Addison's disease. Thank you. Have a nice day.